Blood tests are vital in healthcare. They serve as a cornerstone for diagnosing a wide range of medical conditions, from common illnesses to more complex diseases. Without blood tests, doctors would be left with limited information, making it challenging to provide accurate diagnoses and effective treatments. They help doctors diagnose diseases, monitor conditions, and assess overall health. Blood tests can reveal critical information about organ function, nutritional status, and the presence of infections or other medical conditions. For instance, a simple blood test can detect high cholesterol levels, which is a risk factor for heart disease. Drawing blood, also known as phlebotomy, is the process of collecting a blood sample for these tests. This procedure is typically performed by trained healthcare professionals such as phlebotomists, nurses, or medical laboratory technicians. The process involves using a needle to draw blood from a vein, usually in the arm. Proper technique ensures accurate results and patient comfort. It's crucial to follow the correct procedures to avoid complications such as bruising, infection, or inaccurate test results. Healthcare professionals are trained to make the experience as comfortable as possible for the patient, ensuring minimal discomfort and anxiety. This guide will outline the steps for safe and effective blood draws. From preparing the necessary equipment to post-draw care, each step is designed to ensure the safety and well-being of the patient. Proper preparation includes verifying patient information, selecting the appropriate equipment, and ensuring a clean and sterile environment. Blood tests are like windows into the body. They provide a snapshot of a person's health at a given moment in time. By analyzing blood samples, healthcare professionals can gain insights into various aspects of a patient's health, including their metabolic and hormonal status. They can reveal a lot about what's going on inside. For example, blood tests can detect abnormalities in blood cell counts, which can indicate conditions such as anemia, infections, or blood disorders. They can also measure levels of electrolytes, enzymes, and other substances that are crucial for normal body function. From checking cholesterol levels to diagnosing infections, blood tests provide essential information that guides medical decisions. They can help identify risk factors for chronic diseases, monitor the effectiveness of treatments, and detect early signs of potential health issues. Blood tests play a crucial role in modern medicine. They are used in routine checkups, emergency situations, and ongoing management of chronic conditions. The information obtained from blood tests can lead to early intervention, better management of diseases, and improved patient outcomes. Accurate blood test results depend on proper collection techniques. Any errors in the collection process can lead to incorrect results, which can affect diagnosis and treatment. Therefore, it's essential for healthcare professionals to be meticulous and follow best practices during blood draws. That's why it's essential for healthcare professionals to be skilled in phlebotomy. Continuous training and education ensure that they stay updated with the latest techniques and guidelines. This not only improves the accuracy of blood tests, but also enhances patient safety and comfort during the procedure. Before beginning, gather all necessary supplies. This includes gloves, tourniquet, antiseptic wipes, needles, collection tubes, gauze pads, and a sharps container. Check the patient's requisition form to confirm their identity and the tests ordered.
Explain the procedure to the patient. Answer any questions they may have. This helps alleviate anxiety and ensures cooperation. Make sure the patient is comfortably seated or lying down.
Apply the tourniquet 3 to 4 inches above the intended puncture site. This is crucial as it helps to restrict blood flow, making the veins more prominent and easier to locate. Ensure the tourniquet is not too tight to avoid discomfort or injury to the patient. A gentle but firm application is key. Ask the patient to make a fist. This action helps to increase the pressure within the veins, making them stand out more prominently. It is a simple yet effective technique to aid in vein identification. Encourage the patient to keep their fist clenched until you have located a suitable vein. This helps make the veins more prominent. Observing the veins carefully is essential. Look for veins that are straight and have a good size. Veins that are visible and palpable are usually the best choices for puncture. Palpate the vein using your index finger. This tactile method allows you to feel the vein's texture and firmness. A good vein will feel bouncy and resilient under your finger. Take your time to palpate thoroughly to ensure you select the best vein. Choose a vein that feels bouncy and firm. These characteristics indicate a healthy vein that is less likely to collapse during puncture. A firm vein provides a stable target for needle insertion, reducing the risk of complications.
Avoid veins that feel hard, thin, or fragile. These veins are more prone to damage and can complicate the procedure. Hard veins may indicate sclerosis, while thin or fragile veins are more likely to rupture. These can be more difficult to puncture and may increase the risk of complications. If you encounter such veins, it is better to take your time and find a more suitable option. Patient safety and comfort should always be your priority. If you can't feel a suitable vein, you may need to ask the patient to open and close their fist a few times. This action can help to further enhance vein prominence. Additionally, you can try applying a warm compress to the area to dilate the veins. Always communicate with the patient, explaining each step to ensure they are comfortable and informed throughout the process.
Once you've located a suitable vein, it's time to prepare the area for puncture. Cleanse the site with an alcohol pad using a circular motion moving from the center outward. Allow the area to air dry completely. This prevents stinging when the needle is inserted.
Wearing gloves is crucial during this step to prevent the spread of infection. Never touch the cleaned area after it has been prepped. If you need to repalpate the vein, use a fresh alcohol pad.
Section 5. Needle insertion, a quick, precise motion.
Uncap the needle, keeping it bevel up.
Anchor the vein by gently pulling the skin taut with your non-dominant hand.
Insert the needle at a 15 to 30 degree angle, using a smooth, quick motion.
Seeing the needle can make some patients anxious, so it's best to avoid showing it to them.
Reassure the patient throughout the process. Let them know that a slight pinch is normal.
Section 6. Blood collection, filling the tubes. This section will guide you through the critical steps of collecting blood samples efficiently and safely. Once the needle is in the vein, you'll see a flash of blood in the needle hub. This indicates that the needle has successfully entered the vein, and you are ready to proceed with the collection process.
Attach the collection tube to the needle, keeping it slightly tilted. This helps ensure a smooth flow of blood into the tube and minimizes the risk of hemolysis, which can affect test results. Allow the tube to fill completely. The vacuum in the tube will draw the correct amount of blood needed for the tests. Make sure to monitor the flow and ensure that the tube is filling at a steady rate.
The amount of blood needed will depend on the specific tests ordered. Some tests require more blood than others, so it's important to know the requirements beforehand to avoid multiple punctures. Different tubes contain various additives. These additives can include anticoagulants, clot activators, or preservatives, each serving a specific purpose for different types of tests. It's essential to fill the tubes in the correct order to prevent contamination. The order of draw is crucial to avoid cross-contamination between different additives, which can compromise the accuracy of the test results.
Observe the patient for any signs of discomfort or complications, such as dizziness or nausea. It's important to reassure the patient and provide support if they experience any adverse reactions during the blood collection process. After collecting the blood, label the tubes accurately with the patient's information. Proper labeling is critical to ensure that the samples are correctly identified and processed. Transport the samples to the laboratory promptly. Timely delivery is essential to maintain the integrity of the samples and ensure accurate test results. Document the blood collection process thoroughly. Accurate documentation helps track the samples and provides a record of the procedure, which is important for patient care and quality control. Finally, sanitize the area and prepare for the next patient. Maintaining a clean and organized workspace is essential for infection control and efficient workflow.
Section 7. Needle removal and aftercare, completing the process. Once the required tubes are filled, release the tourniquet.
Gently remove the needle from the vein. Immediately apply pressure to the puncture site using a clean gauze pad. This helps stop the bleeding and promotes clotting.
Instruct the patient to keep the gauze pad in place for a few minutes. This helps prevent bruising.
Dispose of the needle and syringe in a sharps container immediately after use.
Section 8, labeling and transport, ensuring accurate results. Label the collection tubes at the patient's bedside.
Include the patient's full name, date of birth, and the date and time of collection. Proper labeling is crucial for accurate identification and prevents mix-ups.
Transport the blood samples to the laboratory promptly. This ensures that the samples are processed quickly, providing timely results for the healthcare provider. Section 9, safety first, protecting yourself and others. Proper disposal of sharps is paramount to prevent needle stick injuries.
Never recap a used needle. Always dispose of it in a designated sharps container.
Wash your hands thoroughly with soap and water after the procedure.
Phlebotomy requires skill and precision. Continuous learning and practice are essential for maintaining proficiency and ensuring patient safety. Remember to always follow your facility's protocols and guidelines.